It is Wellness Wednesday, and today we are talking about thyroid disease. In the sponsored segment, we welcome to the show Dr. Mohammed Daoud, an endocrinologist at Memorial Healthcare, to talk more about this topic. Good morning to you.
Thanks. Thank you. Good morning.
Thank you for being here. You know, first off, let's start with this for folks at home. Where exactly is the thyroid gland located?
You know, the thyroid gland is located in the anterior part of the neck, just below what's called Adam's apple. It is wrapped around our windpipe, and it is formed from two lobes, like right and left, with a small tissue called the isthmus that links them, making a butterfly, that we call it.
Yeah, so right in here.
Just in the lower part here. Absolutely.
Yeah, so with that said, you know, what exactly is thyroid disease?
Thyroid disease, you know, you can split in two halves. Something related to the function of the thyroid gland, and the other part is related to structure. So you may have overactive thyroid, which we call thyrotoxicosis or Graves' disease. We can have underactive thyroid, that's called hypothyroidism. On the structural side, you may have enlargement of the thyroid gland, it's called goiter, common to the public, or thyroid nodules. Most of them luckily are benign, but some of them, maybe 5 to 10% are malignant. They can be functional as well. And of course, different types of thyroid cancer. Commonest one are called papillary, follicular, medullary thyroid cancer, and aplastic thyroid cancer. Hopefully we don't see many of these patients. Hopefully everybody will be well.
Sure. Why are thyroids important?
You know, thyroid produces different hormones, mainly T4 and T3, which are practically very essential for our metabolism, our energy production. Let me put it this way. It is kind of the gas for the car or electricity for the car, if you're a fan of electric cars, you know.
Sure.
So it does affect us from head to toe, practically.
Okay. What other conditions then can affect how our thyroid functions?
The commonest are familiar to the public really is something called autoimmune disease. Autoimmune disease means that our immune system produces protein that attacks the thyroid, either making it underactive or overactive. But of course, you may have other disease that can be involved, like surgical resection, radiation to the area, inflammation of the thyroid, a big list of medication that can affect the thyroid function. Some of them are prescription, others even over the counter can affect the thyroid labs.
What do you do, what kind of work as a doctor to figure out the nature of a thyroid disorder then?
If I would start here, I'll start with one thing. The way we interpret any workup depends on the setting under which we do the evaluation. So what's done while you're healthy is different than what you're done in the ICU or critical ill. Usually we start with the clinical assessment by proper history and physical examination, looking for those symptoms and signs that relate to thyroid. Do the basic blood workup that usually includes hormone checkup like TSH, T4, T3, among other labs that may include screening for those autoimmune disease antibodies in the blood. Of course, imaging may include ultrasound, thyroid scan, further imaging based on the scenario or the clinical illness.
So a lot of markers that you look for. And then quickly, you mentioned hypothyroidism. Any advice do you think is critical for patients with that condition?
I will stress the point. This is one of the commonest diseases of thyroid gland. Adherence to the medication, taking the medication the proper way, is the most important factor that determines where we go from here. And usually we advise a patient to take the medicine in the morning on empty stomach with water, at least 30 to 60 minutes away from food or drinks. Even black coffee can affect most of the formulation of thyroid gland hormones absorption. So better off to take it the right way, and make sure you inform your provider about any add-on or deleted medication recently, because that can affect the thyroid dose that's used.
Thank you so much for your insight. We appreciate your information this morning. And to learn more, you can go to memorialhealthcare.org, or you can call that number that you see there on your screen. Thank you so much for your time.
Thank you.
Good to see you.
Appreciate it. Thanks for having me.